Hi everyone, welcome to 5-Minute Cosmetic Surgery. I'm Dr. Go. I'm a Korean plastic surgeon. I'm so glad to meet you in my video channel. Today, I'm going to tell you about various materials to raise the nasal dosum. You may know some materials already: silicone implant, Gore-Tex implant, and fillers, and so on. But you don't know exactly which material is better for a certain condition of the nose. So, I'll talk about the advantages and disadvantages of each material, and let you know which material is better to use in which condition. Let's talk one by one. The silicone implant. The silicone implant is the most popular implant in rhinoplasty. We already know there are various sizes and shapes of the silicone implants. In addition, there are different structures of silicone implants. Some of them have a uniform structure end to end, a little hard but flexible. Others of them have a harder structure in the body and softer structure in the tip, because they are made for reduced pressure to the skin of the nasal tip. But I already said, these days good doctors do not put the silicone implant on the nasal tip, so this structure is not that useful. Besides, the difference of surface also exists in various silicone implants. Normal silicone implants have a smooth surface. Some silicone implants have many small holes on their surface. Those small holes induce tissue ingrowing into the holes, which helps the implant adhere to the surrounding tissues. But the tissue ingrowing is not very effective. The implant will not be well fixed. On the contrary, those holes can cause infection more than normal silicone implants. So, I'd like to recommend, do not use the soft tip silicone implant, and do not use the implant with small holes. In addition, they are expensive in spite of no effectiveness. There are two types of silicone implants: I-type and L-type. The L-type silicone implant has the advantage of raising the nasal tip easily and apparently. This part of the implant can support the nasal tip by directly pushing up the skin or by pushing up the ala cartilages. If the implant pushes up the skin directly, the skin must be getting thinner as time goes by. Eventually, some problems will happen, like unnatural appearance of nose, infection, implant extrusion in more severe cases. If the implant pushes up the ala cartilages, this method is safer than direct pushing the skin. But this method also causes some problems, like ala cartilage distortion or unexpected infection. So, I don't recommend the L-type implant. I already said most good doctors raise the nasal dosum and tip separately. So, using an I-type implant is enough to raise the nasal dosum, because the nasal tip can be changed by other methods and by other materials. In conclusion, I'd like to recommend to use the I-type silicone implant for raising the nasal dosum. I'm going to explain the silicone implant. Next step is to explain the Gore-Tex implant. That subject starts in next video. I hope you keep watching my video contents continuously. Thank you for watching and see you next time. Bye.